Well, behind me here at Jim R. Miller Park, what used to be a Cobb and Douglas Public Health COVID testing facility, it has been transformed into a vaccination center here for those who are lucky enough to get an appointment to get a vaccination. After a rough start with a crashed website, it has been nonstop today with a full house of people coming through to get vaccinated. And in fact, they expect to be running at full capacity really for the next few days. As always, we talked with Dr. Janet Memark. She's the director of Cobb and Douglas Public Health on why this is such a crucial time in this pandemic for these vaccines to be rolled out.
So we continue to have just an incredible surge right now of COVID-19 cases. Our PCR numbers for Cobb County are showing us at 918 cases per 100,000. But remember, this doesn't include the antigens, so that's going to put us well over 1,000 cases per 100,000. That means that we have just extremely high community spread right now throughout our district. And so it really is, it's not a good situation to be out and about.
All right, so following the holidays, there's been this big surge likely caused by all the activity around the holidays. So Dr. Memark says those 3 W's we've always been talking about may now have to be the 3 S's.
You know, I heard something very interesting today from epidemiology, that the 3 S's, stay safe, stay home, and stay away from people. And so we're really asking people as best as you can. You remember when we first started the pandemic that we had to put all of these measures in place. We ask you to try to stay home as best you can. If you can telework, try to telework. Try not to gather with people. We're hearing, people having parties over the holidays, and we're definitely seeing the fallout of that right now. So try your best, to not be out and about and around other folks. Even for school, if you can keep your kids home virtual for a while, that's really probably the best thing that you can do. We have a lot of kids that need to be in school right now, and we really appreciate the schools doing everything they can to keep things as safe as possible for those kids. But some kids can stay home to try to lessen the burden in the schools, and that would be a great thing to do right now.
All right, the big story, obviously, that a lot of folks are talking about, the vaccinations. The demand for the vaccine is overwhelmed the supply that they have at the Jim R. Miller Park site. It has crashed the websites, but when they do come up, the slots fill up almost immediately. The theme is to be patient.
There's an extremely high demand for the vaccinations right now, and our state system for scheduling is not quite ready yet. And so we have had to put together some scheduling systems to get these vaccines into arms as best we can. And so we did have a glitch yesterday. And so in our metro district, we have 50% of the state's population in just the metro. And so we had an overwhelming burden, and there were glitches across all the metro counties yesterday. And so we have been able to get that back up, but the demand, we do not have enough vaccines for everybody that want it right now, or even everybody that's eligible. So we'll get our appointments out as quick as possible, but you probably will see that server say that it's busy because there are probably 5,000 people trying to get that same appointment. And so we will open them as quickly as we can, and we base that on how much vaccine and staffing we have to try to get those into arms as quick as we possibly can. Please be patient, and the federal government and Project Warp Speed will get these vaccines out and produce more and more. And so we will get them out and get them to providers, and not just public health, but different providers that can help to get the people vaccinated.
What did you think about getting the shot?
It was easy.
We only release them a few days at a time, and so we're trying to get into a groove here. The state system will be here in the next few weeks, so we only do it based on how much vaccine we have. And so if I don't have vaccine in hand to vaccinate folks, we're not going to schedule them because we don't want to get into that situation.
You know what? The Jim R. Miller Park site here in Cobb County, it's not the only place you can get a vaccination. Dr. Memark says it may pay to look around.
Jim Miller is one of the locations, and Cobb and Douglas Public Health is a provider that is providing vaccines to folks, but we're not the only ones. Remember, we are a small team that has to serve almost 1 million people. So when you go to the DPH website on the COVID vaccine locator, you can go and see where people are providing the vaccine in your district. And so as Project Warp Speed gets more and more vaccine out, you'll see more and more people able to offer the vaccine. So people ask me all the time here, do I have to get the vaccine here? You do not have to get it here. I know Wellstar released 10,000 appointments yesterday. So for their patients, you can get your second second vaccine or your first vaccine with them, there's only one thing to know, which is to get the same vaccine. So either get Moderna or get the Pfizer, whichever you got, be consistent. Around 21 days afterwards for the Pfizer vaccine and 28 days afterwards for Moderna. That's the main thing that you need to know. And so you can go anywhere in the state that's available to you to get a vaccine. We're doing the Moderna vaccine here. So it is, as you go through, it's a great process. You give us your driver's license, and if you have insurance, if you don't, that's okay too. And we get you quickly through and get you with the Moderna vaccine. And 28 days later, you can get another appointment and get vaccinated again.
And for people who have had COVID-19, like myself, it's a waiting game before you can get the vaccination. So what is next? What's coming down the pike? Well, Dr. Memark says there's light at the end of the tunnel, but that light is still months away.
So I think we have a glimmer of hope for the future for everybody in COVID-19. The vaccine is going to play a huge role, but remember, it is going to take us months to get through the people that need to get vaccinated. And so we have to we got to do what we got to do right now, which is we have to try our best to stay home and to stay away from folks. And whenever you're out and about, please try to wear your mask and keep away from other folks at this point. The cases are extremely high, and the hospitals need us to do our part to bring down the caseload right now. So we're asking for voluntary support for everybody to do what they can.